Welcome, guys. This is Motivate OTs. My name is Tongai Chichaya. I'm an assistant professor in occupational therapy, and today is an excellent day. I'm joined by my guest, Dr. Phil Morgan. So Dr. Phil Morgan is somebody that I've known. We have previously worked together at Bournemouth University, where we were leading an interesting module. I think it was called Professional Reasoning for Occupational Therapy Practice, where we were really creative in terms of helping students get to understand how decisions are made in practice, but from an occupational therapy perspective. So today we're going to be discussing an interesting topic, and this topic we sort of like have common ground with Phil when it comes to this. So we're going to be discussing participatory citizenship in mental health. So I know, Phil, you've got loads of experience as an occupational therapist in mental health. You have led recovery and social inclusion. You have been head of professional OT services. And now you've got another bigger job that is to do with quality. Probably you'll just summarize a little bit. So thank you so much, Phil, for making time to join us here. I'm going to give you a chance to introduce yourself in your own words, and then we can proceed with today's discussion.
Great. Thanks, Tongai, and thanks for the opportunity to have a chat about this. So I'm currently head of nursing therapies and quality for mental health, learning disabilities, children, young people and families for Dorset Healthcare. It's a rather long title.
Yeah, that's an impressive title.
And my role is very much around how do we look at improving the experience of people who are using our services and also staff. I've also just recently completed my PhD looking at citizenship, and previously, as you've described, have worked leading work around recovery. I've worked as a lecturer practitioner for Bournemouth Uni, and also been professional lead for occupational therapy across a range of mental health services.
Great stuff. So I'll just jump into our questions. So my first question is, looking at your background, I mean, you have been a lead for recovery and social inclusion for quite a number of years. So I would want you to sort of like briefly summarize, because some of our audience, they might not have an idea of what recovery is. Talk a little bit about recovery as a service model service provision in mental health, and then maybe you can also touch on, based on your experience, the things that you have seen to be working, and maybe areas that also need improvement in terms of using recovery as a model for service provision in mental health.
Okay, so the recovery movement was really led by people with lived experience, so survivors, service user movement in the 80s and 90s, and largely came out of the United States, although it was also picked up in New Zealand and also in England. And the focus really was a shift from sort of thinking about clinical recovery, which was very much around symptom management and looking at, I guess, from a deficit approach to what people could do for themselves, and that power of peer support, and a much more social approach to recovery. So actually understanding people in the context of their lives and what people need to flourish, which may or may not be related to clinical recovery. And then it was adopted by Bill Anthony, who was working in psychiatric rehabilitation, who started shifting service models to thinking about, so if personal recovery is as important as clinical recovery, how do we orientate our services to that? And then since then, we've seen recovery coming into much of the sort of policy guidance internationally in terms of how mental health services should focus, so that there's a greater emphasis on the role of people with lived experience, but also, and I think particularly importantly for OTs, around people being able to build meaningful and purposeful lives. In the UK context, there was an organisation called IMROC, which is Implementing Recovery for Organisational Change, who really framed the need to change what mental health services did if we were going to truly implement recovery orientated services. So that was things like introducing peer workers, setting up recovery colleges, shifting focus on people building meaningful lives, thinking about how people access employment, but also a strong focus on redefining what risk and safety meant. So rather than looking at, again, in that sort of deficit approach, actually, how do we think about shared safety? How do we involve people? How do we collaborate? So in Dorset, we're really fortunate to have a peer-led mental health organisation called Dorset Mental Health Forum. So when we started looking at the recovery work, we were able to do that together from the start. And I think that's really fundamental whenever we're thinking of any approach or any change in mental health, is how do we do that in partnership with people with lived experience? So we started trying to define what we understood recovery to be, working with people with lived experience, working with professionals, working with family members in terms of defining that, and then thinking about how do we make those organizational changes. And on one level, I would say we were quite successful in terms of developing peer work, shifting that culture so that people were thinking more broadly, having that, I guess, much more human focused rather than diagnostic focus in relation to people. But I guess what also became sort of increasingly aware of is I guess that growing sense that recovery wasn't really driving the social change that was needed. And in the UK, this was in the context of austerity, so that there was increasing pressure on services and a reduction in the offer of social care. And really that created a tension where recovery started to be used as a way of rationing services. And some of the responsibility was being put onto people to become well, rather than understanding the context in which people were working. So there's a service user activist group called Recovery in the Bin, and they were essentially saying that
recovery in the bin.
Recovery in the bin. Yeah.
Okay. Like dump, let's dump recovery.
Yeah.
Yeah. Okay.
Yeah, and and I think from the point of view that actually this notion that with the sort of levels of poverty, with the levels of discrimination that people experience, with the context of some of the trauma that people experience, that actually what the recovery approach was taking almost too much of an optimistic view, and also too much of an individualistic view, and a decontextualized view in terms of people being expected to recover. And then that really, I guess, led me to question, is recovery really doing what we hoped it had done to do in the start? And also, what are the unintended consequences of trying to adopt and engage a new approach? And this is where I became increasingly interested in citizenship, and in particularly participatory citizenship.
Yeah. So thanks very much for giving that background to your keen interest in participatory citizenship. And I know you're very keen about people, particularly mental service, health service users, having a voice. And I know you've actually done a lot of work together with people who experience mental health challenges. So from your perspective, how do you define citizenship or participatory citizenship?
So I think, I guess we've all got a notion of citizenship, and it's interesting. I've done a number of workshops around citizenship, and one of the things that we like to do around that is encourage people to bring an object that means something to them in the relation to citizenship. And a lot of people bring in a passport or an ID document, and I think that there is that sort of, I guess, that civic or that sort of legal notion of citizenship. But when you start exploring it with people further, citizenship it obviously includes those things, but it also includes a sense of belonging, or a sense of identity, or having a role or a function in society. And I think that if you look at the history of citizenship in terms of how rights have been won, that's been a dynamic process, and that's been a struggle for people to fight for their rights.
Yeah.
You know, for example, women having the vote, the abolition of slavery, gay marriage. You know, that we're in a kind of dynamic process, and sitting within that is rights for people with mental health challenges. And I suppose the other part of that is we shouldn't be thinking about people with mental health challenges as a kind of a group in their own, but actually that there's intersectionality.
Exactly. Yes.
In terms of other forms of oppression and discrimination. And so I view very much that citizenship, and others who've written much more eloquently about citizenship than I have, as a dynamic process, really. And it's a process of struggle. And I think this is why the importance of people having a voice, particularly those people whose voices often aren't heard, is so fundamental. So for us as occupational therapists, it's very much for me about how do we create the spaces, how do we create the opportunities, how do we create the conditions for people's voices to be heard, and how do we create the conditions, and how do we make the adaptations socially and politically for people to be able to participate as fully as possible as citizens.
I see what you're saying. You're already encroaching into my other question, but it's fine. It's the flow of the discussion, which is great. I mean, you've given that background in terms of the issues to do with citizenship, and I mean, we are discussing people in relation to people who use mental health services. But imagine that aspect that there is intersectionality. Really, it's not about looking at people as one group. But I just want to know from you, based on your experience, the key challenges that you have actually identified or seen being experienced by mental health service users, for example, in terms of their citizenship being restricted or being denied.
So I think the answer is a kind of combination of what people have told me, what people have shared, and also what's in the literature as well. And I think that there's quite a sort of direct stigma and discrimination, but there's also quite a lot of indirect stigma and discrimination. I mean, I think on the first hand, you know, people with mental health challenges are significantly less likely to be in employment, are more likely to die 20 plus years earlier than the general population, are more likely to be living in poverty. So there's sort of structural barriers for people with mental health challenges to be able to do that. But then there's also much more insipid and insidious forms of discrimination where people are left out, they're excluded, they're not involved, they're viewed as different by people within the community, people won't engage with people. And there's quite a lot of different accounts, whether that's, you know, that could be from a sort of babysitting circle, it could be being sort of bullied, harassed. But then there's also what people have described is actually how our diagnostic framework of mental illness silences their voice or the people's voices, so that actually when people are looked at through a diagnostic lens, that they're reduced as people, and also that their voice is somehow mistrusted, and that actually that people aren't reliable in being able to talk about their own lives, or not seen as reliable.
So it's like the diagnosis is actually taking over the identity of an individual.
And then how that language shapes how we as professionals will view and expect people to behave and engage with us. And then when you layer on the Mental Health Act as well, that actually, you know, that the Mental Health Act can take away people's liberty on the basis of their health status, and that people's experience of coercive treatment under the Mental Health Act again can form this sort of cycle of people feeling less connected and less engaged and less able to be a citizen.
Yeah.
And then also there's I guess there's that dynamic process that then people start internalizing that stigma and that sense of shame, and so that this is a really complex dynamic,
Yeah.
and why it needs a really broad approach to really shift lots of these deep-seated structural and cultural approaches to how we meet the needs of people
Yeah.
with mental
Yeah.
health challenges.
True. Thanks for that. So now, if we are to think from an occupational therapy perspective, all these challenges, I mean, it's everywhere really. The challenges experienced or faced by people who've got mental health challenges in terms of their citizenship. So, from an occupational therapy perspective, well, what do you think could actually be done to try and address these challenges based on your experiences, things that you have tried out, things that you have seen?
Yeah. So I think the first thing is acknowledging people's reality, and actually understanding the context within which people are living, and doing that from a trauma-informed point of view as well. So recognizing that people may have experienced sort of personal trauma, but also some of the sort of social and cultural trauma that people will have experienced over the years, and I think that, and that real acknowledgement of the sort of social and economic position that people are in, and being open and honest around that with people.
Yeah. Do you have any examples of? Sorry, to jump in there. Do you have any examples of some of the things that you might have done in your career to try and address the issue of citizenship for mental health service users?
So I think, so one of the things that, so I think probably the most significant thing is to be able to sort of step back and share power and create space.
Right.
So what's been really significant is, and how I've seen my role, particularly in the role of lead recovery and social inclusion, but also now in this role, is using my power within that to create spaces for people with lived experience to be able to share power. And I think that's really fundamental for us as OTs. So that's having, and when I'm talking about sharing power, there's layers of power. So there's that on that individual basis around people being able to make choices and decisions within relation to their own care. But then there's also people being able to shape how services are evaluated, how services are run, how services are designed. And then there's also how people are holding services to account in terms of what they're doing. Now, there's a real role for recovery education within that. And I think that what's really important around that is creating spaces for co-production, which pay attention to those power dynamics so people have a voice, and that then you're creating that notion of shared learning. And I think probably the biggest bit of learning that I've had is it's almost like the more you focus on creating space for people to explore and learn and to share power, the more citizenship outcomes you have. The more you try and intervene to do citizenship, actually you're kind of reenacting a dynamic. So it's quite a subtle shift, but I think it becomes how do we practice, how do we converse, how do we hold spaces, and how we're continually paying attention to those. And I think this is where it links with that, the sort of critical perspectives in OT, occupational justice, in how are we understanding these dynamics and how are we bringing them to the forefront, and how we trying to get alongside people, understand the context that they're in, and then also maximize the opportunities for people to shift.
And it ties very well with cultural humility, where it's about knowing ourselves and also being open to learn about others around us. I mean, and that's really fantastic. Thank you so much for that. And I do believe that your insights, they are very important, and they will be very helpful to our audience, not only in mental health services, but in any other service. I mean, distributing the power if you hold the power, it's about distributing the power so that everyone's voice is actually heard, and that just makes our society a better society. I would want to move on to give you an opportunity, Phil, to just talk briefly about your PhD research in terms of what motivated you to do this and what were sort of like your outcomes or your findings.
Yeah, sure. So I guess where we talked about and got to was thinking citizenship is really important, and actually we need to be looking at that in the context of recovery, but also being conscious that just because you shift your focus doesn't mean that actually that's going to lead to any meaningful change, but also recognizing how slow change is. So what I decided to do was to look at the future. And the other thing that I'm really interested in is the impact of technology, because I think from a lot of the conversations that are going on in mental health around citizenship, there hasn't been a strong focus on technology, the impact of technology. And I guess what the internet and technology does is it creates a whole other communities of interest,
yes,
and global communities and other forms of activism, which shape a whole different way of thinking about what a citizen means. So what I did is I used an approach called future citizenship, and I worked with a digital technology company and a peer-led mental health organization. And I was also fortunate enough to work with some peer researchers on the project, so we were able to sort of co-produce some of the elements within the limitations of a PhD. And I'm not going to go on about that now, but I've written quite extensively about the limitations and challenges of trying to co-produce a PhD and the sort of the power dynamic within that. My only thing that I will say about that is what's really important when you're trying to co-produce anything is trying to be as transparent as possible about what's happening.
Right.
Not all things that aren't co-produced. And I think that sense of transparency and honesty is really fundamental. So working with a peer-led organization, and I asked people about what they thought about citizenship and what they understood. And again, I think that's a really important part of any citizenship work, is actually asking people what their understanding of citizenship is. And that people having an ownership and a sense of being able to self-define that to a degree. The asking people what they thought the specific barriers and challenges for people with mental health challenges were, what the impact of technology is and is likely to be, and then what are the threats and opportunities to citizenship. So I did that we did some interviews, and then we did a co-production workshop where we got everyone together. We presented back the findings from the interviews and kind of looked at what the kind of main themes were there. On the back of that, we made a film with the peer researchers, which is like a future citizenship broadcast, where we're in 2042, and we're talking about I interviewed two people, one who's someone who uses mental health services, who has lots of like AI support and a robot dog that reads their mood and remote care and stuff. And then someone who's a service user activist who's raising concerns about privacy and choice and control. So then we played that video to the peer-led organization. And then there was 4 themes, which one, the first one was around agency and power. So being really explicit about who has power, who has control, who's defining what citizenship is. And I suppose the other thing that's really important in this context is that we're not talking just about trying to change governments, but actually the role that corporations play in shaping what being a citizen is, so that actually we've got wider work there. The other significant concern was around divide, and how division is both being experienced in terms of digital divide, understanding technology, accessing technology, division between the generations, but then also how social media can lead to kind of that sense of political division. So that if we're looking to create inclusive societies, we really need to pay attention to that sense of divide. The other finding, which was probably really, really interesting, was what does it mean to be human? And this sense that actually, is technology changing what it means to be human? And what does touch mean? And actually, if you can interact with a bot, does it matter if you're speaking to a bot or a human? And what are the consequences of all of these things? And are we just walking into this without thinking? And then the final one was around having a voice. and that people strongly define. There's a quote in there that says, for me, citizenship is something along the lines of, for me, citizenship is simple. It's about having a voice and understanding the importance of that.
Yeah.
And the link to that theme was around how people can take action for themselves, the role of mental health services moving into a different shape to enable people to do things for themselves rather than this sort of paternalistic approach, and also the importance of co-production and that sense of true co-production and paying attention to power.
Wow, that's fantastic. Thank you so much, Phil. I'm not gonna let you go until I ask you this question. How do you see the future of occupational therapy and occupational science?
Yeah. So, I mean, I feel that all of these agendas really line up well with the values and principles of occupational therapy and occupational science.
Yeah.
I think that the thing that we need to grapple with as a profession are the power dynamics, because I think that the concepts are all familiar and we're very well intentioned in terms of working collaboratively with people. And I'm sure there's lots of things that people have heard me talk about and they say, oh yeah, no, that's all right, we do that already. And I think we need to be much more critical in terms of thinking about actually what are the power dynamics that sit behind this and what's happening. I think probably the biggest thing is when we're looking at sort of, I guess, distress and how we support people is one of the biggest strengths that we got is our ability to system think.
Yeah.
And I think we need to move away from thinking about people's difficulties as individuals, but actually think about collective care, collective citizenship. Yeah. And how do we create models of support that are around engaging people? And one of the things that we're looking at and we're implementing in Dorset at the moment is open dialogue. But that's probably a whole other talk. But I think about those collective approaches to but also I think OT, we've got such an important role in not just working with individuals to change citizenship, but working with communities and societies. And I think that this is our big opportunity, is almost like a public health approach to mental health and well-being. And I think that actually, how do we utilize technology to create more inclusive opportunities? Yeah. How do we use our skill sets to work with communities to make them more welcoming and accepting places, rather than us solely locating the need in people to change? And also, how do we, and this is where again the citizenship comes in, is that the citizenship bit isn't just about people who use services enacting their citizenship to drive change. It's also about how do we enact our citizenship to drive change, to have a fairer and more just approach, and that our role as activists to create communities and societies that support people more effectively and to address some of the social issues. Because when we're medicalizing mental health problems that are based and rooted in social problems, we're part of the problem.
Exactly. Wow. That's profound. That's profound. Thank you so much, Phil. I know my time is running out, but thank you so much for making time, and thank you so much for sharing the insights that you've shared. And I'm sure our audience will appreciate this discussion and take some of the lessons learned and try to implement them in different settings that we find ourselves in as occupational therapists. So thank you so much, Phil.
Okay. No, thanks, Tongai.
Okay. All right, guys. We've been having a discussion around participatory citizenship with Dr. Phil Morgan. And we've just come to the end of this discussion. I hope you find this insightful, you find this helpful. Feel free to share the content. So thank you so much. Until next time. So for now, it's bye-bye.